Hello everyone. Today I'll be discussing caffeine, its sources, mechanism of action, its health and therapeutic benefits, its side effects and toxicity. I'll also talk about adenosine and adenosine receptors. Caffeine is found in seeds, leaves, and fruits of over 60 plants worldwide. The common sources of caffeine include coffee beans, tea leaves, cocoa beans. Caffeine is also added to food, beverages like energy drinks, soda, and certain medications. Caffeine is a natural stimulant. It's known for its ability to boost alertness, energy, and focus. The mechanism of action of caffeine is basically the ability of caffeine molecules to block the adenosine receptors in the brain, in the heart, and the blood vessels. The ability of caffeine molecules to block adenosine receptors is because caffeine and adenosine molecule have closely related molecular structures. Caffeine also increases the activities of the neurotransmitters dopamine and norepinephrine. By simply blocking the adenosine receptors, caffeine increases the release of dopamine and norepinephrine. Dopamine transmits signals between neurons in the brain, thereby playing key roles in the reward and pleasure, motivation and drive, movement and coordination, mood regulation. Norepinephrine is also known as adrenaline, a hormone and a neurotransmitter. It's involved in attention and arousal, stress response, mood regulation, blood pressure regulation, energy metabolization. It's worthy to note, guys, that the blockade of adenosine receptors by caffeine molecules brings about the increased neuronal activities, contributing to caffeine-stimulating effects such as improved alertness, enhanced cognitive functions and focus, increased energy, increased heart rate and blood pressure, increased release and activity of dopamine and norepinephrine. Adenosine is a neurotransmitter and a modulator. It is an inhibitory neurotransmitter promoting sleep, relaxation, and reducing neuronal activities. Adenosine is involved in energy production and consumption, particularly in the form of ATP. Adenosine helps to regulate heart rate, blood pressure, and vascular tone. The effects of adenosine are often the opposite to those of caffeine, which blocks adenosine receptors, leading to increased alertness and energy. Now, let's talk about the adenosine receptors. These are a family of G protein-coupled receptors that respond to the binding of adenosine. There are 4 subtypes: A1, A2A, A2B, and A3 adenosine receptors. Caffeine molecules bind to only A1 and A2A receptors, blocking adenosine molecules from binding to them. This leads to increased alertness and wakefulness when the A1 receptors are blocked by caffeine molecules. It can also lead to enhanced cognitive function and motor activities when A2A receptors are blocked by caffeine molecules. Adenosine receptors are found in various tissues and cells in the body. They are widely distributed throughout the body, which reflects their diverse physiological roles. Adenosine receptors are found in the brain, heart, blood vessels, kidney, smooth muscles, and in the immune system. Now let's delve deep into the mechanism of action of caffeine. Cells in the body during metabolic activities break down adenosine triphosphate for energy. Hi guys, I just want you to know that adenosine can also be released in response to cellular stress like hypoxia, which is the deficiency of oxygen in the cells and the tissue, and also during inflammation. Adenosine can be released from the neurons during neuronal activities as a neurotransmitter or a neuromodulator. As the brain uses energy throughout the day, the level of adenosine gradually increases inside the neurons. This brings about the excitation of the neurons by some adenosine molecules. Adenosine molecules bind to adenosine receptors, causing sleepiness. A high adenosine molecule in the brain is an indicator that the brain has been active and needs to rest. There are neurons that keep the brain awake and active. And on these neurons are A1 adenosine receptors. If adenosine molecules activate these neurons become less active, and this slows down brain activities. There are also neurons that initiate sleep, and on these neurons are A2A receptors. If adenosine binds to these receptors, the neurons become more active and induce sleep. The act of falling asleep is as a result of the combined effect of a variety of hormones and the combined activation of these two neurons. The brain replenishes its energy reserve during sleep and starts the elimination of adenosine till a point when there are very few adenosine molecules left in the brain to activate adenosine receptors. At this point, one wakes up feeling energetic and refreshed. It's worth it to note, guys, that the molecular structure of adenosine and caffeine are not exactly the same. Caffeine can only compete with adenosine for adenosine receptors and can equally block adenosine receptors, but cannot activate adenosine receptors. The blockade of adenosine receptors by caffeine molecules prevent adenosine molecule from binding to them, thereby preventing sleepiness. Caffeine lasts for about 4 to 6 hours in the body. This depends on the metabolism, age, liver function, individual sensitivities, and genetics. Once the body breaks down caffeine, adenosine can once again bind to the adenosine receptors to induce sleepiness. Caffeine is not as addictive when compared to other stimulants like cocaine and methamphetamine. The regular and prolonged intake of caffeine could lead to the body's reduced response to caffeine. This is tolerance. Now let's talk about caffeine withdrawal symptoms. The sleep-inducing effect of adenosine may intensify, leading to symptoms like fatigue, drowsiness, difficulty in concentration, irritability. All these are the opposite effects of caffeine. The above symptoms can be prevented if caffeine users continue taking caffeine, which results in a sort of physical dependence on caffeine. But this is not strong enough to be called addiction. The withdrawal symptoms experienced by sudden stop in the use of caffeine in chronic users can last up to a week until the adenosine receptors return to their normal level. These withdrawal symptoms can be reduced by gradual reduction in the intake of caffeine over some time rather than a sudden stop. This basically occurs because the neurons synthesize more adenosine receptors, a sort of compensatory action for the adenosine receptors blocked by caffeine to block the additional adenosine requires receptors. More intake of caffeine. Too much consumption of caffeine could lead to headache, dizziness, insomnia, jitteriness from higher heart rate, dehydration from increased urine production. Caffeine could be considered a safe drug. There could be slight physical dependence in users, but this is not strong enough to be regarded as addiction. It's basically difficult to overdose in caffeine. The lethal dose of caffeine vary from person to person, and this depends on the body's weight, individual sensitivities, health conditions, and how caffeine is consumed. The Food and Drug Administration estimates that the oral dose of caffeine greater than 10 grams could be fatal in adults. The FDA also considered 400 milligrams of caffeine per day to be generally safe in healthy adults. The warning signs to the overdose of caffeine include rapid heart rate, anxiety, nausea, seizure, and in severe cases, death could result. Thank you for paying attention to this lecture. This is Ladies Farmer YouTube channel.